Hi everyone, Ivan here from Imitated Environments. Today I'd like us to take a moment to check out the basics of our exciting new product, Pharmacy Simulator. If you want to find out more about Pharmacy Simulator, visit the links in the description below, www.pharmacysim.com. I don't want to waste too much of your time though, so let's jump straight in. Pharmacy Simulator is a detailed simulation of pharmacy practice aimed at anyone who wants to learn more about the practice of being a pharmacist. So most scenarios revolve around a given patient encounter, and as the player we have to treat this patient as if we were the pharmacist, or as the case may be, the pharmacy technician. In this particular example, we're exploring a scenario that's aimed at about third-year pharmacy students. So these are students who are familiar with prescription requests and complex conditions and are being trained to look for some of the more subtle potential drug-related problems. So we can see here that
my doctor has changed my heart pills again. I have a new prescription.
Charles has a new prescription for Bicor 5 milligrams. This is bisoprolol, which is marketed as Zebita in some international markets, I believe. At this point, we can sort of hop over to the dispensing computer and take a look at Charles's history. Right, so we've got various heart failure related medications here. Probably the critical one here is this lower dose of Bicor. So I'm recording this on the 1st of April. So 3 weeks ago he was given the 2.5 milligram tablets, half a day for 2 weeks, then one a day. So he should have taken 14 tablets of the 28 he was dispensed there. So he should still have quite a few left. And since that was 3 weeks ago, Australian guidelines tell us that the dose should be increased every 2 weeks. So it's a bit odd to see him coming back after 3 weeks. So we've got a few questions to ask him here. Hey Charles, can I ask a few
Not
questions?
a problem.
We want to know if his doctor has any particular plan.
I don't really understand it, but she said it was something to do with my heart treatment.
Okay, there's nothing specific there. So there's a few red herrings here. Do you have any allergies? Well, it's not a very relevant question here because we've just seen that he's already had this medication. Now, if he was being non-compliant, then he'd burn through his pills too fast. We would expect that he might have increased symptoms of breathlessness or fatigue, potentially. It's also just a good question to ask here, just in case.
No, I seem to be doing all right at the moment. No worse than normal for me these days, anyway.
Okay, so he's all right. Compliance, the big one here. Do you have any of your 2.5 milligram tablets left?
Yes, around 10 I think.
Okay, so it seems like Charles has been taking roughly the right amount of tablets at least. If we're going to solve this mystery, we just have to call the doctor. So let's ask him if he's okay with that.
Sure, if you think it's important.
Okay. So we're going to hop on the phone and call his prescriber. Hi, Dr. Watson.
Of course, happy to help.
Again, we've got a few red herrings here. I can see interaction between Ramipril and furosemide. The target dose is 10 milligrams. Let's get up to that. There's an interaction between aspirin and bisoprolol. Legal validity. Yeah. These are all the sorts of things that students might come up with if they're being a bit overly zealous, particularly if they put Charles's medication history from the computer into a software package like MIMS or something like that, and it spat out every possible piece of advice. None of them are particularly relevant apart from this top one here. I think the bisoprolol dose increase may be a little too fast. So let's give that a go.
The specialist wrote to me and asked me to increase the dose. Hang on, you're right. We should increase the dose more slowly. Please start the 5 milligrams tablets in 1 week. I am glad you called. Thanks.
We have a plan of attack. The dose increase is definitely faster than was intended if he was to start those medications today. Still has a supply of his 2.5 milligram pills at home, so he can keep taking those for a little while longer, then start on the 5 milligram. So let's dispense this. Bicor 5 milligram. And the instruction was 1 a day for 2 weeks, then 2 a day. 1 a day for 14 days, then 2 a day. So we've got this nice little standardized form here for filling out instructions. Dispensing software doesn't typically have this. It has more of a sort of shorthand text field. The reason why we've got it this way is to sort of simplify that process a little bit, and importantly to allow us to assess it, because there's so many different ways you could write correct instructions in a free text field, whereas by having these drop down boxes, etc., we standardize the process, and by standardizing the process we are able to assess what the student enters and judge whether it's correct or not. So I'm going to get the robot to fetch and label this product for me because I don't want to do it. So he's going to run off and do that for me, and he'll drop it off over here. Thanks, robot. Let's give him his medications and give him some information about what's up. Charles, I have your prescription ready. Let's talk.
Sure.
Okay. It's got a few options here. So there's a couple of incorrect options here. I've talked to your doctor. Let's go hard and fast to get up to the target levels. It's important to take the medication as prescribed. So that's take it as it was written. But this top one here is the critical one. I've talked to your doctor. It's better if you increase the dose slowly. Take 2.5 milligrams a day for 1 more week, then increase to the 5 milligrams tablets. Important to note, this option here would not have been available if I hadn't hopped on the phone and called that doctor.
I appreciate your time in helping me today. Having this heart problem is a real worry for me, and you help put my mind at ease.
No worries, Charles. Just do my job. So now we'll give him some just sort of general advice. This advice here about storage, largely irrelevant. This advice here about if you get swelling. So this is describing an allergic response reaction. He's already taken this medication before. An allergic response to this medication is pretty unlikely, so I don't think we'll bother with that. Bisoprolol should be taken regularly and not stop suddenly. That's important.
Okay, I am very particular about my heart medicines.
Good man. This medication is best taken on an empty stomach. Well, that's just not true. You may experience a slight deterioration in symptoms when you increase the dose. So that's good advice, I think. He needs to be prepared for that possibility and what to do if it is more serious.
Oh, I hope not. I hate feeling breathless.
Don't we all? Alright, so I think we've done everything we need to do here. We've given him the medication, we've identified the sort of slight error. So I think I'll just ask him if we're done. Is there anything else I can help you with
That's
today?
everything. Thanks for your help.
You're welcome, Charles. Okay. So now we get this scorecard here. This details every action we performed. So the action is here on the left. The feedback associated with that action is on the right. And then we get a score, a numerical score next to that. I can see that we did pretty well here. We got 24 out of 24, 100%. It's almost like I've done this before. So I'm pretty happy with my performance there. You can see I gave the right product. I put the right label on it. Now what would normally happen here is the student would make some mistakes, most likely on their first attempt, and they would get some feedback telling them, oh, you did this wrong, you did that wrong, and they would hit try again. But I'm just going to use this as an opportunity to show off sort of what happens when you don't do the right thing and give you an idea of sort of how expressive this simulation can be. So if we talk to Charles and we go the rude option, what do you want?
I need this prescription filled.
Okay, still gives him the prescription, but we can see then from his response, his body language has changed. He's grumpy, he's agitated. So if I ask him, can I ask you a few questions?
If you must.
Okay, he's not so keen on it anymore. What did your doctor tell you?
I dunno, something about my heart.
Yeah, he's closed right off. So we've annoyed him. And because he's annoyed, he's giving us different responses. Now for this scenario, the critical thing was that we had to call that doctor and ascertain that the dose increase was too fast. There's something I'd like to talk to your doctor about.
I'm in kind of a hurry, really.
Okay. So this is a mechanism by which students can sort of explore not just figuring out what the best options are, although that's obviously the sort of key use case, but also they can explore what happens when you don't do the right thing and get a feel for sort of why best practice is best practice. It gives them that context, that grounding. If you're interested in taking a look for yourself, you can do that. If you go to the link in the description below, www.pharmacysim.com, you can sign up for a free trial. You can get access to Pharmacy Simulator and around 10 scenarios to demo. You can also obviously Biopharmacy Simulator and read more about it. So if you're interested in hearing more from me, do the YouTube dance and hit like and subscribe. Other than that, I hope you've enjoyed. Thanks for watching. Cheers.